It's Wednesday. Welcome to our Wednesday Wellness Tip. For today's physical tip, I'd like to talk a little bit about heart disease. It was brought to my attention in the last 2 to 3 weeks, 2 young people who were diagnosed with heart issues, one under 30 years old and one under 40 years old. This is too young to be dealing with heart disease. And heart disease is still the #1 killer, even with COVID. So it is very important that we pay attention to it. Now, most of us are familiar with having our cholesterol checked, but usually your provider will only measure the standard lipid panel, which includes, of course, your total cholesterol, your good cholesterol, which is the HDL. You can think of H for healthy, that's the good cholesterol, triglycerides, and then the LDL, which is the bad cholesterol. And you can think L lousy to remember that that's the bad cholesterol. But do you know that many people who die of a heart attack have a normal standard lipid panel? In fact, 50% of people who drop dead with a heart attack never even knew they had heart disease. Now, what's so important to realize is that even though heart disease is a silent disease, there are warning signs. So one of the warning signs is to do a little bit more advanced panel, an advanced lipid panel. So for instance, in our office, we commonly measure the advanced lipid panel, which looks at a detail of the standard lipid panel. Did you know that there are actually 5 different types of the good cholesterol? And we're most interested in the good of the good cholesterol, which is known as the HDL large. There are 13 different types of the LDL. And so regardless of what your LDL is, if you have a huge percentage of the small dense LDL and the medium LDL, this can create a very inflammatory pattern and a risk for heart disease, because these small dense LDL can slip under the endothelial lining of the heart, of the arteries, and set up an inflammatory cascade, which then can block the artery, causing a heart attack or a stroke. So it's really important that you have an advanced lipid panel done. And this just shows you one example, and it's not important that you know every value, but you can see that even though her standard panel is mostly in the green, there are some inflammatory patterns when you look at the advanced lipid panel. And after a few months of our recommendations for diet, exercise, then you can see that now she has no more red in her advanced lipid panel. So heart disease is preventable. The second test that we commonly recommend for people to have is a coronary calcium CT scan. Now this is a CT scan of the heart, which actually looks if there's any plaque in the coronary arteries. So it's like doing an external cardiac cath. Now we have referred probably over 300 patients in the last 2 to 3 years to have a CT calcium score of the heart. And most of the time we find that there is no plaque in the coronary artery. However, in the times that there is, that's when we get very aggressive in terms of our treatment, protocols, and our recommendations. So this scan is available in town. If you'd like to learn more about it, give our office a call and we can refer you to have this CT calcium score done. And for sure, if you have any history of heart disease in your family or stroke, you definitely want to do an advanced lipid panel. So that's our physical tip for today.